the next virus family we're going to talk about are the coronaviruses. And coronaviruses, for the longest time, were just the second most common cause of the cold. So not really all that clinically relevant. And now, under that same virus family is SARS. You remember that we had, we'll call it an epidemic, a few years ago with SARS, where there were lots of deaths attributed to SARS in China and where? Toronto, Canada, and Guangdong province of China. Now, SARS, I'm not sure if it's made it on to the step 1, but it's just a matter of time before it gets on there. So we want to look at it in a little bit more detail. The reservoir for SARS are birds, and a special kind of cat called a civet cat was the main reservoir. And the virus is transmitted by respiratory droplets. So if you Google SARS, and Google image it, you'll see all these images come up of individuals during that SARS outbreak wearing masks to prevent inhalation of the virus. The original case of SARS is thought to have jumped directly from animals to humans, okay? And that is somewhat unusual for a viral infection, okay? Now, SARS is something that causes atypical pneumonia, although there are very specific parameters that are still needed for diagnosis, okay? So if you look at the case definition, you need a fever greater than 100.4, your flu-like illness, your pneumonia-like symptoms, okay? And the chest x-ray is going to be kind of a patchy infiltration. But also, in order to diagnose SARS, you need a history of travel to an endemic area, okay? So the diagnosis includes those symptoms plus a history of travel to an endemic area. What are those areas again? Guangdong, China, and Toronto, Canada. Now, how do we diagnose it? We can do that by PCR. We can isolate the virus. By PCR, we can give you a definitive diagnosis. That's what happened during the outbreak of SARS. And treatment for SARS at the time was mostly supportive, but now they're playing around with ribavirin as a treatment for SARS, as well as interferon, and those are actually looking fairly good as the drugs of choice for treatment of severe acute respiratory syndrome.